Hello, good morning and welcome. My name is Maria Teresa and I'm here to pass forward an auto treatment towards well-being directed at the upper airways. This treatment is inspired by a kinesiological approach, and it's directly inspired by the approach of Davide and Maria Rita. I feel compelled to mention that David and Maria Rita are two wonderful individuals who some time ago decided to develop a program towards the well-being and the awareness of themselves and the others. So you might ask yourself, I did, what's the catch? There is no catch. It's a present for the community. And so this is a time that we might be in an isolated situation, we might be in a lockdown situation, or simply we might be stressed about something, and so this treatment might help. So I start directly by saying that we're going to direct our attention as we're going through the treatment to three directions. The first is we're going to use our hands, so we're paying attention to our hands, the sense of touch. We're going to pay attention to our breathing. We have to remember to breathe and consciously. And we also have to pay attention to what's happening within our body as we're treating ourselves. So we'll start immediately. Yes, one more thing I would like to mention. We are starting, as in most kinesiology approach, from the outside, so from the surface towards the inner part. So we're starting to prepare the areas that we're going to work on, which is the neck area in the front part and our face. So we start by doing this technique. We're doing little traction up and down, left and right, circle to the left, circle to the right. So we're starting on our neck. We're moving gently up and down, left and right, circles to the left, circles to the right, up and down, left and right. We try to cover the whole area, circles to the left, circles to the right, up and down, left and right, circles in one direction and the other, and also in the center, up and down, left and right. We try to be gentle with ourselves so that our body registers a positive experience, and so we might want to repeat that and give ourselves more well-being. And so we warm up this area, and as we go along, we remember to breathe and to pay attention to what's happening within ourselves. It could be a physical sensation. So, for example, when we're doing this, we might feel that we want to swallow. And so we do it. It's perfectly normal. We don't have to hold anything. This might loosen up some fluids. And we're preparing this area first so that if when we work on the face, we feel like we're making space, basically. Okay, so now we are warmed up the front part of our neck. We start with our face. The aim is we cover all our face with the same technique. So we just go up and down, left and right, circles in one direction, circles in the other, and we breathe. And we move along the jawline, up and down, left and right, circle in one direction, circle in the other. You might feel that some areas are more tense than others, and you just take notice. You remember to be gentle and to breathe. We move along the jawline and the cheeks, up and down, left and right, circles, one direction in the other. We go towards the inside part of the cheeks, up and down, left and right, circle in one direction, circle in the other, and along the top of the cheekbones towards the temples, up and down, left and right. The aim is really to completely move the connective tissue so that the posture that the face has kept, maybe too long, it's moved. And we're warming up this area, up and down, left and right. Circle in one direction, circle in the other. We follow on top of the eyebrow, up and down, left and right, circle to one direction and the other. And the forehead, you can use more fingers or one finger, whatever you feel most comfortable. I tend to use all my fingers. Up and down, left and right, circle in one direction, and also close to the hairline. Up and down, left and right, circle in one direction, circle in the other. We cover the entire surface so that the entire connective tissue of our face and neck is now warmed up. And as we have completed the warming up part 1, we now do the download and discharge. So we start from the area close to the nostril with 1 finger, 2 fingers, 3 fingers, whatever you feel most comfortable. We follow the line and we slide down, download and discharge. We breathe in and breathing out, we download and discharge. And we do this 3 times. And then we do it starting from the middle of the eyebrow. So we breathe in and we breathe out, we download and discharge, also 3 times. One more time. And the top of the forehead. We download and discharge. Okay, so then we go to the next step. We follow the same path, but this time we use a different technique. So first we were doing a traction, so we were gently moving the connective tissue side by side and in circles, so to get a move. Now we're going to step forward, going inside, giving small pinches to the connective tissues. Always work gently, because that is the best way to get the longer effect. So we start with the neck, we pinch the area. I find that I can only better do it with 1 hand. And we pinch gently, and everywhere we breathe, we pinch, we send our breathing. And there might be some areas that are more tense than others. We really continue the warming up. We remember to breathe and also to see if there's anything that is happening within our body, if there's anything changing. But we do not try to analyze it, we just want to take a note. And now we cover the face, so we start pinching the chin. So the right way to do it is to apply enough pressure that you feel you're doing something, but you're not experiencing any pain. So your work on the chin and around the mouth. These tiny little muscles around the lips, on the cheeks, and move towards the jaw. You remember to breathe. And sometimes we find there are more tense parts, and that's where we mostly tend to stop breathing, and instead that's where we need to breathe more. And underneath the eyes and around the temples, on top of the cheekbones. Excuse me. You see something is moving, and I am getting a sense of something is liquefying. The temples and on the eyebrows. So the golden rule is that when I do something through the kinesiological approach, I first prepare the tissue and the surface that I'm going to work on. Now I start to go downwards, so I still pinch. If here you cannot get to pinch properly, you can use the 2 hands to do this kind of contraction and moving the skin around, because the forehead might be too tight. So as I was saying, the golden rule is that whatever treatment you're going to do, is you get a feel of the area you warm it up, and once the tissue is prepared, once that area is prepared, then you do the treatment. So we're still preparing our area. I feel I want to swallow. So obviously I have moved something. So we go back to the neck, and we might experience that now it's a little bit looser. We might experience that there's something that has moved, and we remember to breathe. So now we do the same path, but this time, as we are going up pinching, we might feel that somewhere, for example, I have it here, there's some part that feels a little bit more tense than the other. So I do not apply more pressure. No, I am more gentle, but maybe I want to stay there a bit longer. And as I am there a bit longer, I try to concentrate to bring my breathing there. I might feel strange at the beginning, but actually it does go there. And I breathe, and as I feel that the tension is being released, I release the pinch and I continue. I continue until I find maybe there's another spot that it's a little bit tense. I have it here in my chin, so I stop. I breathe there. And I pay attention, is anything else happening within my body? If I wish, as I'm doing this, you can close your eyes and experience if there's anything else happening. And I continue. I concentrate also, maybe there's some more tension close to the jawline here, where there's this very strong muscle. I breathe there where I want to stop. This is a general treatment, but then once you have got the hang of it, you can personalize it and you'll know yourself better and you know when you need more attention. And I continue. Around my eyebrows and the temples. So the more we do this, the more we develop a relationship with our hands and our breathing and our body, and it's like our body will tell us where to go and what to do in order to feel well. So now that we have moved all this around, we're going to download and discharge. So we start with downloading and discharge in the neck 3 times, and we're doing it manually, so with our hands, but we also can put some visualization, like we're cleansing something. So the second time we do from the nose around this area. We start here and we go down 3 times. So the second part, is to visualize, because if you put together a manual technique, and a visualization, it really helps the effect to get stronger. And then we go to the eyebrows and we download and discharge by sliding down 3 times. And last time in forehead, we download and discharge. We breathe in and breathing out, we download and discharge. Okay, I feel like I have to download and discharge my hands. I've been working a lot with them today. So if all worked well, now your face might feel a little bit tingling or warm or red according to whatever situation you were in before you started, but definitely should feel a little bit different from the beginning. So now that we have prepared, we're warmed up, we have mobilized a little bit the connective tissue, now we're going to do a little bit of a stretching maneuver, still gently, by applying some traction. So we did the up and down, left and right, turning to this one side, turning to the other. We've done the pinch, and now we're doing the traction. So we're pulling away the connective tissue. So we'll start directly from this area here. So we put 1 or 2 or 3, I like to put 3 fingers around the nostrils and we don't pull in, we pull out, like we are applying a band-aid to our nose, and open our nostrils and we breathe. The amount of time is really according to what you feel it's enough for you. I usually do it 2 or 3 long breaths. And then I move to the next part, which is a little bit more towards the outside in the middle of the cheekbones. So I do not contract, I stretch. And I breathe. And as I breathe, I try to see if there's any sensation arising within me. The last part, we're doing it. Put the hands towards the ear, I put them like this, and I stretch, and I breathe. I stretch gently without feeling any too much sensation. And I now download and discharge. So I do 1. I breathe in, I visualize a cleansing moment, and now that I have done a stretching maneuver horizontally, I want to do it also vertically. So I work around the eye, I choose which sides to start. For convenience, I'll start with the right. So I put my fingers close to the inner part of the eye, and I gently pull, gently, because this is a very delicate area. And I pulled the one top hand towards the top and the other one towards the bottom, like I want to separate the hands. And I stop there and I listen as I breathe. Then I move towards the center part of the eye. I stretch gently and I breathe. And I move towards the outside part of the eye and I stretch, I breathe, and I pay attention if there's any sensation arising. And then I move to the other eye. So I go again to the middle part, to the inner part of the eye, and I find a spot where to pull, and I stretch, and I take there the breathe. Beside looking like fools, this is quite a good technique to do to relax your eyes. After a long day, maybe at the computer, so we go to the middle part and we find a good, comfortable hold, and we pull away the hands from each other. It's also, besides being good for your eyes and being good for your airways, it's also good for your emotions, because on your face, emotions show on your face whatever you do during the day. And sometimes this gives contractions to some parts of our face. So this massage is also a great way to relax. Okay, now that we've done that, we do a relax, download and discharge. So we go below the eyes, we breathe in and breathe out, download and discharge 3 times. And then we do it on top of the eyes, over the eyebrows. We breathe in and breathe out, download and discharge, visualizing this stagnatic energy now flowing again. That's what I like to imagine. Okay, so we have done around the eyes area the stretch, and now we want to do it on the forehead. So we worked our way up. So we find a place close to the eyebrows in the middle, and we stretch. And we breathe in, excuse me, and we breathe out. And again, we pay attention if there's anything, any sensation, any feeling, any fluid We might have a cold and now we want to blow our nose, for example. Okay, and then we go to the middle part, more towards the center, and we stretch. We take direct breathing, and we pay attention if there's any sensation arising. Okay, and so now there's one more. It's like we are going to pull the connective tissue on top of our forehead up. So it's more comfortable to do it like this, but for convenience of the video, I'm going to do it like this. So I pull, gently stretch, I breathe, and I pay attention if there's anything else arising within my body, just as a weakness, no judgment. Okay, and now I go to the two parts on top of my eyebrow, on the forehead, and I pull up, I breathe, and the very last, we just go on the very top, close to the hairline, and we pull gently, we breathe. And now that we have completed the treatment, we download and discharge again. So now again we start from the eyebrow, we slide down, breathing with pleasure 3 times, and the forehead in the middle, we download and discharge, and the hairline. We breathe, we download and discharge. Okay, so this was the treatment. I hope you've enjoyed it, and if you did, do pass it forward. And if you'd like to see more, there's a collection of more treatments. They're still in Italian. We're working on translating them into other languages, but right now they're being translated by Google on YouTube. So thank you. Have a nice day. Bye bye.